Let's take a tricky topic today, the cost of an IVF cycle. Why is it that costs are different in different clinics? Is the method different? Is the technique different? Or what is it that makes the costs different? See, we are strong believers that an IVF process is a highly evolved and a technical process. It needs support from the right kind of equipments and the right kind of trained manpower. It is not a skill, it is a technical process. And therefore, to supply the right kind of equipments and the right kind of manpower, money has to be spent. They have to be maintained, both the equipments and the manpower. They need to be regularly trained and updated. So there is a definite cost associated with that. Next, we have to understand what are the components of an IVF cycle. We need to give injections to the woman to make her eggs grow up. These injections could be the lower cost HMG types or the higher cost recombinant FSH types. We would prefer that you take the recombinant injections because they are more purer forms and they are more reliable, but the costs are definitely higher. There is other factor also, the equipments, other than the equipments, the consumables that we use in the lab. What are consumables? Things that have been used only for one couple and then thrown away. Most of these consumables come from the Nordic countries. They are expensive and one-time use only. And for reasons of obviously efficiency and sterility, we would never want to reuse them for you. So then they also build up the cost of an IVF cycle. Finally, the cost of the cycle also includes the money that's been paid for the overall clinic, the people who work there, including doctors like us. So if you really look at all the components together, that's how the cost of an IVF cycle is designed. Why is it that some centers are costing less and some centers are costing more? Centers which are doing large volume of work, there the cost may be slightly on the lower side because the costs are getting distributed over a large number of patients. Centers which are doing lesser work may have higher costs because of that. Then there are other things to keep in mind. There are some clinics which follow very strict compliance system. There are a lot of compliances that have to be followed in a proper IVF program, and that has a cost. There is a software cost. People have to be appointed to make sure that all the data is compiled properly and maintained properly. You would want to come back after 7 years and want to know what happened to your embryos that were frozen 7 years back. How do we do that? We maintain that data for you with the help of support staff and software. That costs money. So IVF essentially is not a one-time investment. There could be repercussions for you throughout your lifetime. You would want to know about your embryos if they have been frozen 7, 10, 12 years down the line as well. After we've discussed the cost of equipment and manpower, and also the fact that larger clinics can distribute the cost better, we also need to understand the cost of compliance. It's not a simple matter. Embryos are kept in the clinic for years together. Data has to be kept properly. Compliances of all kinds, regulatory compliances, state compliance, patient request compliance have to be maintained. We need to have a software in place. We need to have people who are running this software properly, working on this software. That also has a cost and that also gets added. So essentially, please understand, you cannot really compare the cost of a clinic A with the cost of a clinic B because the working styles are completely different in these two clinics. The media consumable that is being used, the medicines that are being used, the equipments that are being used, whether these clinics have backup facilities or not, whether they are having a software facility or not, whether there are people who are monitoring compliances on time or not, all that puts together and that adds up to the cost of an IVF cycle. Please keep this in mind when you choose your clinic solely on the basis of the cost of the cycle. Thank you.